All right, guys, we are almost done. So what we're going to do now is chapter 5. There's only like a few slides of these, so like 19. I think I just did a quick review for those, and like if anything I thought was important. And then I'm also going to include chapter 12 in this as well. Like I said, I mentioned what's starred and what's not. 5 is just review. 12 is really short, so I'll combine both of them in this one video, okay? So getting started, Perio chapter 5. It's the gingival review. So what is the color of healthy gingiva? Uniform pink color. Okay, we know this. How is the gingival margin presented in healthy gingiva? Smoothly scalloped in an arched form from papilla to papilla. Okay, how is the gingival margin presented in healthy gingiva? We know this. It's scalloped. Beautiful. Diastema has what kind of papilla? Flat. There is none with a space. There's no contact area, no coal. It's flat if there's no contact. Attached gingiva is firmly attached to underlying cementum and bone. However, on his exam, he may say periosteum. So underlying cementum and periosteum, okay? The book says bone, he said periosteum. So just know the both. Definitely cementum. What is stippling? We know what that is. It's a dimpled appearance due to connective tissue projections within the epithelial tissue. If you've seen the other videos, you know about that, okay? You know about that stippling. 40% of adults, right? So let's keep going. In healthy gingiva, where is the gingival margin, right? Slightly coronal to the CEJ. So in healthy gingiva, the gingival margin is slightly coronal to the CEJ. Turtleneck, we want it up there. Okay. What is the inflammation that is confined to gingival tissue with no effect on attachment levels? We know this. Inflammation that's confined to the gingival tissue with no effect on attachment levels? Gingivitis, mildest form of periodontal disease. What do trained eyes look for in gingiva? The 3 C's, right? So we look for color, contour, and consistency. Gingivitis, we know, is inflammation of gingiva, causes tissue to become red and swollen, bleed easily, sometimes tender. Why is gingivitis bright red? Why is it bright red? Because inflammation results in increased blood flow to the gingiva. So, yeah, that's why it's red, is because inflammation results in increased blood flow to the gingiva. What is edema? Edema is increased fluid within tissue spaces. Swelling, so we have inflammation, we have increased fluid within the tissue spaces, and all those white blood cells get there to try and help and everything. Bulbous papilla. Bulbous papilla is enlarged and bulges out of the interproximal space. Blunted papilla is flat. It does not fill the interproximal space. Cratered papilla is scooped out, leaving a concave depression associated with necrotizing gingivitis. Necrotizing gingivitis, like not good, scooped out. Where is the gingival margin in gingivitis? Coronal to the CEJ due to swelling. Okay, so it's never at the CEJ. So inflammation gingivitis is at its normal level, coronal to the CEJ. That's where we want it to be. That's where it stays because there's nothing going on. Yes, the junctional epithelium coronal portion opens up a little bit, but it's still attached to the CEJ, to the coronal portion of the CEJ. What happens to the sulcus lining during gingivitis? The sulcus lining becomes ulcerated and the blood vessels become engorged. And we know it produces more cells. The sulcus lining becomes ulcerated and the blood vessels become engorged in the sulcus lining of gingivitis. What 2 subjects are documented in gingivitis? The extent of inflammation and the distribution of inflammation. Extent of inflammation, is it localized or is it generalized? Localized is confined to the gingival tissue of a single tooth or a group of teeth. And then generalized is all or most of the tissue in the tooth or in the mouth. Goodness. One more for this one. Distribution. So we have localized or generalized, right? And then distribution. Papillary, marginal, or diffuse. These are the three terms that we'll use for gingival description of gingivitis. Papillary means there's inflammation of the interdental papilla only. Marginal is inflammation of gingival margin and papilla. So gingival margin and papilla. And diffuse is inflammation of gingival margin, papilla, and the attached gingiva. Diffuse, okay? It can be locally diffused. It can be generalized and diffuse, okay? That is chapter 5. That was the highlights from there. So now we're going to go into chapter 12. Really easy. There's only a few slides there too, which is a great switch up to these hour videos. So let's go to number 1. There's a star here. Bacteria. Bacteria is the primary etiologic agents in the initiation of periodontal disease. It's not really the reason, but they say it's the primary reason of the initiation of periodontal disease. Not the reason, but for the initiation of it. Bacteria. What does the amount of bacteria mean? There's a star here. The presence of bacteria does not mean an individual will experience periodontitis. Lots of bacteria does not equal periodontitis, and small amounts of bacteria can equal severe disease. So really, it doesn't matter how much bacteria is present. It all depends on the host response, really. Multifactorial etiology. Star. Okay, so periodontitis results from the interaction of many factors. Multifactorial. Where does it come from? So factors other than bacteria play a role in periodontal disease, and periodontitis results from the interaction of many factors. So who knows? There's a lot of different things that make it all happen. Risk factors, here we go again, there's a star. Variables that increase the likelihood of periodontitis. They do not initiate the disease. It does not mean an individual will get periodontal disease. It just increases that likelihood. Risk factors simply increase the likelihood. It's not the reason to get it. It's just going to increase the likelihood. Modifiable versus non-modifiable risk factors. There's a star here. So modifiable can be changed. Non-modifiable cannot be changed. We know this. Give 4 categories of risk factors for periodontitis. 4 categories of risk factors for periodontitis. Hereditary, systemic, and medicines. That's all in one category. Hereditary, systemic, and medicines. That's kind of like your health. Okay, hereditary, systemic, and meds. You've got habits is another one. So your habits is a risk factor. Periodontal pathogens is a risk factor. Do you have those specific bacteria in your mouth that's going to be a risk factor that may initiate that stuff more frequently than others? And then social atmosphere. So social atmosphere, what's in your social atmosphere? I think I break these down actually. I do. So hereditary and systemic, there's a star. So hereditary is like an immune deficiency, genetic syndromes. So hereditary is, immune deficiency, leukemia, something like that. Actually, I think that's systemic. I don't know. But hereditary, immune deficiency, you don't have a lot of vitamins and stuff to help you fight off infection. So maybe that's a risk factor. It is actually. And then systemic, like diabetes, okay? It's a systemic issue. Risk factors, habits. What kind of habits are you doing? So self-care, like plaque control. How are you brushing? How often? Professional care. Are you going to see help? Are we cleaning your teeth? Are you recalling? Smoking, alcohol, and diet. So for habits, self-care, professional care, Smoking, alcohol, and diet, all risk factors. Social atmosphere. Here we go. So it's your family, your upbringing. Did they teach you how to brush your teeth? Your culture. Do you believe in brushing your teeth? Social economic factors. Access to dental care, dental insurance, all that stuff has to do with the social atmosphere. So do you have availability to get to dental health care? Do you not believe in it? Do you have dental insurance? Is that a factor, a risk factor that's not allowing you to get the help you need? Periodontal pathogens. There's a star here. He says he's not going to ask the names of these, but there's a star here. So P. gingivalis. That's easy to remember. P. gingivalis, gingivitis, P. gingivalis, gingivitis. We have Tannarella forsythia. Tannarella forsythias. Tannarella forsythias. Not sure how to remember that. It's a periodontal pathogen though. Tannarella forsythias. So Tannarella. Tannarella. Just gonna have to say it. T. forsythia. Tannarella forsythia. I have no idea. So we're gonna move on to the third one. A. actinomycetomycomycins. Oh Lord. A. actinomycetomycom. Oh, I'm not even gonna try. So A. actino. Just know that. And then whatever the actino, MYCE, just go with that one. So A. actino, Tannarella forsythia, and P. gingivalis. We know that. We'll get to know these two. We'll get better at these, okay? But he says he's not going to ask the names of them, but there's a star there. So biological equilibrium, there's a star here. It's a state of balance in the body, also known as homeostasis. Biological equilibrium, homeostasis, state of balance in the body. A few more. Periodontal health, balance, there's a star here. Most of the time, state of balance between biofilm and the host, the person. So in periodontal health, we want that balance. We want a healthy state of balance between our biofilm and ourself. And most of the time, that's the case. Periodontal disease, balance, star. Balance is changed between pathogenic bacteria and the host's immune response and inflammatory response. So that tip in the scale when there's periodontal disease in the balance. Balance scale, disease promoting factors on one side and health promoting factors on the other. Balance swings toward disease when changes occur in the host, such as systemic illness, medication, smoking, poor diet, and stress. So those can tip the scale. And the last one, give examples of how individuals respond to plaque biofilm. Respond differently to plaque. Okay, so star here. Give examples of how individuals respond differently to plaque biofilm. Well, we know this. Most patients never progress to gingivitis. Well, from gingivitis to periodontitis. That's one example. Even with poor plaque control. Some patients with inadequate self-care process from gingivitis. So some people that don't even take care of themselves never progress from gingivitis to periodontitis. Most patients never progress from gingivitis to periodontitis, even with bad plaque control. It's kind of the same thing. If host immune response can maintain a mouthful of periodontal pathogens, destructive periodontal disease will not occur. So if you're used to having all those bad bacteria in your mouth and your body's used to it, they fought them off, they know how to fight them, they know how to work with them, you're not going to get it. So those are some examples. And that's it. That was really short, simple. That takes care of 5 and 12. Now we only have 13, and then we're done reviewing for Perio. I hope it all helps.